Welcome to The Explainer. Today, we're diving into a treatment for post-traumatic stress that is getting some, well, truly remarkable results. It's called the Reconsolidation of Traumatic Memories Protocol, or RTM for short. So let's get right into it and ask the big question, could this really be the breakthrough we've all been hoping for?
To really get what's at stake here, we have to start with the human cost. The author Jose Naroski once wrote, "In war, there are no unwounded soldiers." And that just hits you, right? It's a heavy reminder of those invisible wounds, the kind of trauma that can follow a person for their entire life. And the scale of this problem, it's just staggering. We're talking about 10 to 20% of U.S. military members who were deployed in recent conflicts now suffering from PTSD. That is a huge number of people whose lives are just fundamentally changed by this. So that leads to a really critical question. How are we actually doing at treating these wounds? Well, unfortunately, the answer shows us just how limited our current treatments really are, and it makes it crystal clear why a new approach is so desperately needed. This right here shows the tough reality of PTSD treatment today. You know, our best, most common therapies, things like prolonged exposure or cognitive processing therapy, they still leave 60 to 72% of patients with a PTSD diagnosis. And sure, medications can help some, but those benefits, they pretty much vanish the moment you stop taking them. The treatments themselves can be a real ordeal too. They're long, a lot of people drop out, and they can literally force patients to relive their worst moments over and over again. So, if the old path has these major roadblocks, what does a new path even look like? Well, this is where the RTM protocol comes in. And it's not about just blocking a memory or coping with it. It's about going in and fundamentally rewriting it. The science behind RTM is actually tapping into something your brain already knows how to do. It's a process called memory reconsolidation. The best analogy? It's like editing a document on your computer. When you open an old file, you can make changes and then save a new version, right? Well, it turns out your brain can do the exact same thing with memories. For a very short time after you recall a memory, it becomes, well, unlocked. And in that window, you can actually update it with new information before your brain saves it again. Okay, so that's the science. But how does RTM actually use this process in a therapy session? Let's walk through the steps. They're surprisingly elegant, and the whole thing is designed from the ground up to not re-traumatize the patient. The core of the therapy is this amazing thing called the movie theater technique. So first, the therapist has the patient imagine they're sitting safely in a movie theater, creating this feeling of distance. Next, they watch the traumatic memory play out, but, and this is key, as a silent black and white film on the screen. It helps them stay dissociated, to not feel it. Then comes the magic trick. The patient imagines stepping into the movie right at the very end, after they've already survived, and they experience the entire event backwards, in full color, in just a couple of seconds. Finally, they get to be the director. They rewrite the story, rehearsing new, non-traumatic versions of what happened. Now, that technique might sound simple, maybe even a little strange, but the results, they are absolutely profound. So let's dig into the evidence from the clinical trials. Before we even get to the success rates, this comparison shows why RTM is causing such a stir. Standard therapy can take up to 18 sessions of really direct, often grueling exposure to the trauma. RTM, on the other hand, averages just 2 to 4 sessions, and the exposure is minimal. It's designed to be non-traumatizing. For patients and therapists, that is a total game changer. And the results are just striking. In a recent trial with UK military veterans, the RTM protocol was more than twice as effective as standard therapy. Get this, RTM patients saw their symptom scores plummet by 18 points on average. The folks in traditional therapy, an 8-point drop. The difference is huge. And that result holds up across study after study. A truly staggering 90% of patients who are treated with the RTM protocol no longer meet the diagnostic criteria for PTSD. Let me say that again. They aren't just managing their symptoms better. They are considered to be in remission. Their diagnosis is gone. And this isn't something that just works for one specific group of people. The protocol has been proven to be effective for U.S. veterans from the Vietnam era all the way to today, for military women who've survived sexual trauma, for UK vets with really complex PTSD, even for civilian first responders, survivors of family violence, and in some really recent work for Ukrainian refugees fleeing an active war. It just shows how incredibly robust and widely applicable this thing is. So when you look at how effective it is, how quick it is, and how accessible it is, what does all this mean for the future? The implications here go way beyond just having another therapy option on the list.
So let's just put it all together. What is the RTM advantage? Well, it's highly effective. We're talking over 90% remission. It's incredibly brief, averaging just 3 sessions. It's non-traumatizing. It's way, way cheaper, costing less than $1,000 compared to over $8,000 for standard care. The results last, and it's accessible to pretty much anyone, anywhere through telehealth.
You know something's really starting to break through when it shows up in a place you'd never expect. In 2022, the famous comic strip Doonesbury actually featured RTM in its storyline. I mean, that's how you know this conversation is moving out of the clinical journals and right into the public consciousness. So we've seen that our brains have this natural ability to rewrite memories. And we've seen a protocol that seems to harness that power to basically neutralize trauma. Which leaves us with this one really profound question. If a painful memory can be safely and permanently rewritten, what does that really mean for the future of healing?